There's a troubling new study out about smoking, and it plays right into the ongoing debate over income inequality. There is a clear and disturbing divide between rich and poor when it comes to smoking. Take a look. Americans with a high school education or lower make up 40% of the U.S. population, but they're 55% of the smokers. And of course, that has profound and potentially deadly consequences for people in poverty. So what to do about it? Let me bring in Michael Erickson, former director of the Office on Smoking and Health at the CDC under President Clinton. Aisha Moody-Mills is senior fellow at the Center for American Progress Action Fund. Good morning to both of you.
Good morning, Chris.
Michael, let me start with you because this study also shows people with money and education are quitting smoking at a much higher rate. What do you think is going on here?
Well, it's quite dramatic. First of all, higher educated, wealthier people have always smoked less than other groups, but the rate of decline has really accelerated for the wealthy and the rich. What we've seen is 25% reduction in smoking among those with high school education and a 75% reduction in those with a college degree. So not only the rates higher for those with less education, but the rate of decline is less speedy.
And poor women, Aisha, are particularly vulnerable. While about half of high-income counties, and they broke this down literally by county, half of those high-income counties showed significant declines, but when it came to low-income counties, it was only 4%. Why is the message not getting through, particularly to poor women?
Well, I think that it's not surprising that we see a trend here with smoking that is reflective of the trend with health and wellness disparities across the board, with poor people, people of color, LGBT Americans as well. There are a host of symptoms of poverty, quite frankly, that are playing out here that we need to discuss in terms of how we deal with the structural issues on the ground that people, are facing in these communities where they're smoking.
Well, let me read one thing to you, Aisha, that was in the New York Times. It's a quote. "Few people interviewed said they were glad to be smoking, but many said it was one of the few pleasures they could afford." Which I live in New York City where the taxes are so high that smoking is actually very expensive. That may not be the case in some of the rural areas.
Yeah, that hits the nail right on the head, is that people are using smoking as an outlet for pleasure because it's the only thing they have available, given that they're facing so many struggles in their day-to-day life with unemployment, with, being underemployed, with food insecurity, with health and wellness issues. And so I think that we see that with smoking. It's also important to note that tobacco companies predatorily market to these communities as well. Smoking is high among the poor, among people of color, among LGBT people, because tobacco companies go directly for them and are kind of pushing these products down their throat, which is why it's important that the FDA regulate tobacco as best they can, and particularly get rid of menthol cigarettes.
It is important to say, Michael, that the overall number of people smoking has declined. And some of the credit is given to some of these ads. I think we have one we can show you that the CDC put out as part of a national campaign. They target teens. They show the graphic effects that smoking can have. But what do we do now? How do we continue this progress? Because, as I mentioned, the implications for public health are enormous.
Absolutely. And recently the Surgeon General's report came out and celebrated its 50th anniversary from 1964. And during that time, in a half a century, smoking rates have been cut in half. It's a huge success story, but we're only halfway there. There's still over 40 million Americans who smoke, and we need to disrupt the status quo and make much more progress, because smoking continues to be the leading preventable cause of death in this country. And we can't just tolerate going along with a 1% or 2% reduction a year. We really need to accelerate it, and we know how to do that. We just haven't done it yet.
Michael, Aisha, important conversation. Thanks to both of you.
Thank you.